I started to treat my relatives and friends, and since most of them survived, I was sure that homeopathy might be a good choice. Time to extubation is significantly shorter in the homeopathy group.
Sepsis is always a challenge at any department. And you challenged sepsis with homeopathy.
And the aim was to find out whether or not homeopathy might influence the survival.
Hello, this is Barbara Liberowicz. I am a medical doctor. My guest today is Professor Frass, professor of University Vienna. He is internist and intensivist, but most of all, he is the skilled homeopath. Could you please tell us about your activities, about your medical career, and what was the first encounter with homeopathy?
Thank you so much for inviting me, Dr. Liberowitz. I started with my medical study in Vienna at an age of 18. And when I turned 20, I met a doctor who performed obviously some strange type of medicine. So I was curious to meet him, and Dr. Gerhard Resch, he invited me for a discussion. And on his tables, there were books from Hahnemann, Aristotle, the Bible, and so on. And he spoke in just another way I was used to in the medical university. And I started to listen to his lectures. And then I started to treat my relatives and friends. And since most of them survived, I was sure that homeopathy might be a good choice. And slowly but steadily, I increased the volume of treatments.
We know you have huge experience treating patients in ICU with allopathy plus homeopathy. And this is very unique experience. I remember you performed a study on COPD. This patient often end up with acute respiratory failure as they are already chronically respiratory insufficient. Could you please give some examples?
Several years ago, a friend of mine, he was talking on the phone to his wife, and suddenly he stopped. So his wife called her brother-in-law, and the brother-in-law found the patient lying in the garden with the head in the snow under a tree. So while he had just learned about cardiac resuscitation in TV a few days ago, he perfectly performed mouth-to-mouth ventilation and also cardiac compression. And the patient was transferred to the hospital, and he recovered perfectly with regard to neurology. However, when I visited him in the hospital, the lady doctor told me there's a big problem, and I asked, what's the problem? And she said, yes, there are profuse tracheal secretions due to nicotine abuse, as well as chronic obstructive pulmonary disease, COPD. So I went to the nurse and I asked her about the consistency and the color of the secretions. And I was told it is very ropey, tenacious, thick, and yellow. So I decided to administer the patient Kalium bichromicum, CH200. And 1.5 days later, the patient could be extubated, while the lady doctor had told me it will need some weeks until he can be extubated because he might choke due to these profuse tracheal secretions. And the patient was healthy from this time, and he's still alive now with a pacemaker combined with a defibrillator, and he's doing very well.
And you performed also a study about Calibic in COPD.
Yes, I did this study, and the study revealed that if there are two groups, one with Calibromicum, the other one with placebo, and both patients in both groups are suffering from profuse tracheal secretions, then the patients in the group with homeopathy, they have less secretions after 2 days, and the length of stay is reduced in the ICU. And also, of course, the time to extubation is significantly shorter in the homeopathy group.
We all know sepsis is always a challenge at any department. And you challenged sepsis with homeopathy.
I think sepsis is a very interesting disease. It's known for more than 1 century and described also in the old repertoires in homeopathy. So the main problem seems to be that only in about 30% of sepsis episodes, agents can be found which might be responsible for infections such as bacteria or viruses. In 70%, you might not find any infectious agent. And I believe that sepsis is primarily a problem with immune system, and it is not primarily induced by bacteria viruses. I believe that bacteria and viruses might only invade the patient in a second row, while the patient's constitution has worsened. And therefore, I believe if you improve the state of the patient or the immune system of the patient, then the patient himself or herself may be able to overcome this severe disease.
Do you remember any case, very spectacular, you want to share with us?
I like very much the case of a 20-year-old patient. She was always in good health, and she was in school and at the end of her training. And just 1 month later, she found out that she was pregnant in the 7th month. The reason was that her menses was always irregular and she didn't gain much weight, so she wasn't aware about her pregnancy. So 2 months later, there was a section with complication because of amniotic fluid embolism, and 1 day before section, there was a swelling of the right thigh. 4 days after section, there was redness and swelling of the left arm, and she experienced fever up to 39 degrees of Celsius. I think the reason for this might have been that the venous cannula has been too long in her vein. Now, on day 12, the patient showed a pulmonary infarction with pleurisy on the left side, effusion and thrombosis of the vena cava inferior, as well as the vena ovarica dextra. Splenomegaly was accompanied by splenic infarction and respiratory thrombosis. Now, due to the fact that the patient was suffering from a therapy-resistant sepsis, she received a high-dose heparin infusion. In addition, she developed acute respiratory insufficiency, and this made the transfer to the ICU necessary. There, she developed a thrombus in the right atrium, a thrombotic occlusion of the vena jugularis interna sinistra, and also side disorders due to a sinus thrombosis. The C-reactive protein as an inflammation marker was 40 milligrams per deciliter. The upper limit should be 5, and the leukocytes were above 20. On day 42, there was a thrombus excision from the right atrium and occlusion of this open foramen ovale. She needed a high load of respiratory support and a high concentration of catecholamines. On day 43, pleural empyema was operated. She needed veno-venous mechanical hemofiltration due to renal failure, and there was also resuscitation because of cardiac arrest during this surgery. Furthermore, there was a dysfunction of the liver and disorder of coagulation. On day 58, the patient was extubated, but 2 days later, she had to be reintubated. Due to thrombosis in the pelvis as well as in her feet, day 68, a cover shield had to be implanted, and multiple abscesses in the area of her breasts and of her bottom were drained and dotted. And interestingly, bacteriology all the time was negative. So actually, this is not so much a case of sepsis, it's a case of systemic inflammatory response syndrome, which shows the same parameters as sepsis, but you don't find the bacterium or virus or fungi. Again, the patient had to be, could be extubated, and day 84, there was another thrombosis of the vena subclavia on this left side. And on day 92, there was another treatment of a recurrent right bottom abscess. For all these 3 months, while the patient was lying on another intensive care unit, the inflammation parameters were highly increased, and the fever was all the time between 37.5 and 39 Celsius. While the reason for the thrombosis was unclear, the only finding was a heterozygous prothrombin polymorphism. But the experts explained that this cannot be the reason for this severe coagulation dysfunction. Now, after about 19 days, or I think it was also 95 days, I was introduced to this patient, and I looked to the repertory, and there was a differentiation of these homeopathic medicinal products, and there are mainly 2 remedies which are very important in the postpartum phase. One is pulsatilla and the second is lachesis. So I took the history with help of the parents because the patient was not able to help. And I decided to start with lachesis once per day. The next day, the temperature dropped for the first time after 3 months to 37 degrees, and the patient developed immediately appetite. And up to this point, parenteral nutrition was administered because of complete loss of appetite. And this made especially the father very happy because he emphasized at least 3 times that his daughter is not eating. On the same day, the patient was sitting in the armchair. Now something special happened on day 97. There was a decrease of a pronounced face edema, accompanied by an increase of the lower leg edema. And I think this is following the Herring laws that the healing should come from above downwards. The CRP now was about half as compared during the acute phase. It dropped down to 20 and furthermore to 11 another 2 days later. On day 100, the conventional colleagues decided that antibiotics could be cancelled, and 1 day later, the stomach tube could be removed, and there was no ascites anymore. The first medication was lachesis, and since I had the feeling the patient needed more support of her psychological situation, I decided to give pulsatilla soon after. And I continued with lachesis in even higher doses and pulsatilla. And the mother recognized that her daughter was returning to her previous behavior. As already mentioned, the father was especially happy about the normal appetite, and the patient started to take part in her life again. And for the first time, she asked for her boy. You know, all the time she was lying there for a long time, and she didn't ask. And the side disordered disorders started to dissolve. And she did the first steps on day 109. In addition, there was an upper leg eczema, and a dermatologist recommended to use cortisone. So I decided that cortisone should not be applied because I was afraid that eczema might be gone into the body, and after a few time, the edema and the eczema disappeared. In the computer tomography, no effusions, no abscesses couldn't be found anymore. And on day 131, she could be discharged home. So I think this is a case where I had the feeling after 3 months on another ICU, just after 1 day of lachesis, the situation changed significantly.
Okay, can we please go back to the repertorization?
I would say in septicemia, pyemia, lachesis is one of the most important remedies. I think the number 2 would be pyrogenia. And the specialists also after delivery, lachesis as well as pulsatilla are very, very important. And in addition, if you have complaints during pregnancy, as has happened in this situation, this might also support the choice of the remedy. And it's also helpful if there's inflammation of the blood vessels, in addition, of course, thrombosis and emboli. So for me, lachesis is the first remedy I like to administer in cases of embolism. But of course, Crotalus, Horderus, and Crotalus cascavella might be also good choices.
Coming back to the history you took from the parents, do you think lachesis was just the acute remedy, or what was your impression? What could be the constitutional remedy of the girl?
I think it was an acute remedy in this situation. It might have been that it was also, to some extent, a constitutional remedy, while I would still believe this, because while she also had some symptoms of pulsatilla in an emotional way, when I met her later on, I think she was more on the lachesis side. At least I was suggesting this. But of course, I decided only on the symptoms found at the acute situation. We did a study in patients with severe sepsis. It was a randomized, prospective, double-blind, placebo-controlled trial in the ICU. And the background was the high mortality in these patients. It might be up to 35%. And the aim was to find out whether or not homeopathy might influence the survival. And 70 patients suffering from severe sepsis received either homeopathic treatment or placebo. Each group comprised of 35 patients. And each prescription was administered in a quantity of 5 globules in a potency of CH200 at intervals of 12 hours during the stay in the ICU. And survival after a day, a 30 and 180 days period was recorded. All patients were randomized in treatment, and only 3 were excluded because of incomplete data. Now, the randomization process was starting after before 24 hours after meeting the sepsis criteria. All patients who were eligible were sequentially randomized into 2 groups with either homeopathy or placebo, according to a computer-generated code. And the globus were given twice daily at a 12 hours interval until sepsis resolved or until death. So the endpoint was death within 180 days. Those was a baseline demographic statistic characteristics, which were not statistically significant, different. And the baseline clinical indices were all without significant difference, except for one item. Now, I think this is the most important. The survival after 30 days was not significantly different, but after 180 days, the P was 0.43, so it showed a significant difference. And this is a table showing the most used of the remedies, and Lachesis muta as well as phosphorus were highly used. So in conclusion, we suggest that additive homeopathy might be a helpful tool to prolong the patient's survival when suffering from sepsis.
Okay, very impressive. I would like to come back to the remedies that were used in this septic condition. As you mentioned, number 1 was Lachesis. So we already saw the case with disseminated clotting all around, even in the right atrium, which is not so often observed. What other features of Lachesis would you like to point out?
I think Lachesis is always interesting if there is high fever and the C-reactive protein is increased. And of course, if there is any change in the color of the skin, for example, on the left side, like an erysipelas, and the usual color is more blue or livid. And then there might be something like a red string going upwards. And of course, everything which happens on the left side.
Coming back to Lachesis, you said it is left-sided. Did you use any other snake remedies in sepsis?
I like also to use Crotalus horridus and Cascavella. Actually, I have the feelings they're very more or less identical. And another remedy which might be also very helpful is Pyrogenium. And also in many cases, maybe Belladonna or Arsenicum album. So I think there are several remedies which might be considered. But for me, I had the feeling that Lachesis is number 1.
Also, we saw many cases of phosphorus in the chart of in the list of the remedies.
Yes, we also used phosphorus, especially if there was a pneumonia associated with sepsis, and either on pneumonia on both sides, and especially, of course, if it was on the right lower side. And there might be also kalium carbonicum and macrosolubilis considered. But I think phosphorus is very, very strong in these cases. And of course, if the patient's constitutions also fits to phosphorus, it makes it easier. Another remedy which might also be considered if there's a pneumonia on both sides is Bryonia alba, especially if the beginning of the pneumonia is already a few days ago.
As you know, my favorite remedy is Arsenicum album.
I would use arsenicum album, especially if there's a heart failure and cardiovascular problems. I would use arsenicum album, and also if the patient is extremely exhausted and weak.
You have some experience with Amanita intoxication.
Man was presenting mushrooms to his neighbors, and there were 4 people eating these mushrooms, while the neighbor said, okay, this is not enough. I will go for myself again into the forest. And soon after, a 70 years old lady suffered from severe intoxication symptoms, and she was admitted to the emergency department of the Medical University of Vienna. And due to her reduced consciousness, she had to be intubated, and she developed a 5-organ failure and was transferred to our ICU. So we informed the specialist for liver transplants, and he refused to take her on the list because he said she's too old and in a very bad state. So I talked to my colleagues and the nurses, and I said, okay, if you don't mind, we could also try to support the patient by help of homeopathy. And the colleagues said, okay, do it, because everybody was sure she will not survive. So we started with arsenicum album, CH200, every hour, 5 globules. After 2 days, the liver started to explode, so we switched from arsenicum album to phosphorus CH200, also every hour. And after 3 days, the liver was calmed and normal, and the patient was in a reduced cerebral state. So I decided to use Helleborus niger, and for some reason I gave it only once a day, and it took about 2 weeks until the patient regained complete consciousness, and everything was fine, and she left the ICU. So in Bulgaria, there was another case of Amanita phalloides intoxication. There was a lady, she was about 20 years, and after intoxication, she developed cardiac arrest. She was successfully resuscitated, and the colleagues gave her phosphorus CH15. And after a few days, her situation was completely normalized, and the liver parameters went back to normal. So we published these 2 cases, but up to now, I haven't got any response, except for some enemies of homeopathy who complained, oh, Dr. Frass, wants to heal Amanita phalloides by homeopathy. So I wanted to perform a study inviting the enemies to participate in a double-blind, prospective, placebo-controlled.
Oh, you wanted to give them Amanita.
Amanita phalloides study, of course. This is a joke, but I just want to make clear that it's not easily possible to perform a study. But in Amanita phalloides, to my knowledge, up to today, there's no causal therapy in conventional medicine, which might save the patient's life.
Any other clinical conditions in ICU you would like to share?
There was a lady, she was about 60 years old. She was living in an unhappy marriage. One day she experienced weakness. She was admitted to the hospital, and at the general ward, she experienced cardiac arrest, and now she was resuscitated in a protracted way, which means intubation did not work perfectly. Therefore, oxygenation of the brain was not sufficient, and she had to be transferred to the ICU in another hospital far from Vienna. And the sister of this patient, she called me and she asked me to think about a remedy. And I said, I don't believe that anything can help. But she insisted, and then I said, okay, I believe from literature, cuprum metallicum is mentioned. And so the patient received cuprum metallicum CH200, and to the surprise of all the doctors and of course of the relatives, the patient regained consciousness on the next day. But from this day on, it was not allowed to give any more homeopathic therapies. And the patient came back to normal, and up to the day, she takes care of her house, and she's in a normal state. After extended surgeries, especially in male patients, there appears a psychotic disorder. So the patient is sometimes very aggressive. He accuses everyone, including his wife, of being bad or not supporting him. And the patient might destroy some things, or he pulls out his catheters and makes a lot of problems. So a lady doctor from the cardiothoracic ICU, she found out that Hyoscyamus helps in many cases, and she administers CH200 also in a repeated way, and this helps in many cases to calm down the patient's aggressiveness. So I think Hyoscyamus, as we know from Materia Medica, is one of the remedies like belladonna and stramonium, which are helpful in aggressive patients. In a perfect case, the patient would also pick on his clothes, and maybe he or she might also exhibit him or herself, so she takes off her clothes.
Okay, so Professor Frass, what is your message for homeopaths about ICU patients?
I just encourage you to try. It's not difficult, it's easy, and it may help significantly.
Professor Frass, you might not remember, but many years ago, I was gifted this book from you. Even you wrote a dedication, even for me.
Thank you so much.
And
for keeping the book.
I was challenged with German language of this book, but now I've learned this book has been translated into English.
Yes, this book is now available in English by Narayana Publishers. And whenever you have time, I recommend to read it because several different authors have contributed.
Professor Frass, thank you for all the knowledge. Thank you for accepting the invitation, and hope to see you again at Homo Sapiens platform.
I also thank you so much.